Good afternoon. My name is Larisha Birdie McDonough, and I'll be discussing an article that I wrote analyzing the factors that contribute to intimate partner violence. As a brief introduction, we'll begin with some background into the topic. Intimate partner violence is a pressing social issue. It's something that we've seen even recently in the headlines with the Johnny Depp versus Amber Heard case. What that case lets us know is that irrespective of status, irrespective of fame, irrespective of socioeconomic status, intimate partner violence still is a pressing social issue. So the question then is, when we see people of lower socioeconomic status and people of higher socioeconomic status, such as Johnny Depp and Amber Heard, what possibly could these cases have in common? What is the heart of the causation, the causal link for intimate partner violence? If it's perhaps not socioeconomic status, maybe it is. That's what we analyze here in the article, here in the paper. And it seems that there are other factors, as a spoiler alert, that sort of come to play. Certain gender dynamics, maybe the use of drugs and alcohol and things like that. So this is certainly a relevant topic, although it's one that has been researched. It's certainly relevant, one that, again, has been pushed back into the spotlight and into the public discourse by these cases. But one that now lets us know that we need a clearer understanding. And also, it's an issue that is continually pervasive. We're steadily seeing it happen in not just the media, but sort of in our day-to-day existence. So we need to re-examine what kind of intervention strategies there are that we can use in order to combat the heart of this issue. And so the aim of my study is to explore the incident characteristics of intimate partner violence, focusing on gender dynamics, because that has to be a huge part of the conversation, substance abuse, and prior victimization, which can help us inform prevention and help us develop strategies for intervention. The objectives of the study, to go further into that, were to dissect the characteristics of IPV incidents and how they vary, specifically in terms of the gender of the defendant, but also the gender of the victim. That was the first objective. Secondarily, we wanted to look at the correlation between substance abuse and intimate partner violence. I find that one to be very important and fascinating, because that is the one that varies or that probably remains consistent, I should say, among different socioeconomic classes. When substance abuse becomes an issue, we often see intimate partner violence. So controlling even for those other variables where substance abuse is there, we wanted to look at how important it was. And then the impact of prior victimization on perpetuating IPV. So if you've been victimized before, whether that's with the current partner or with a past partner, how likely is it for you to be a victim of IPV again? And so then the goal here is to provide empirical evidence that shapes tailored and gender sensitive interventions, something that works not just for women who are victimized by men. That's a huge chunk of it. But also those men who don't have a voice in the conversation that are victimized by women, but also the gay, lesbian, transgender populations and other queer populations can also benefit from this research, because it does not just look at the gender binary. The methodology we use, this is just an overview. We go into obviously more specifics in the article, but the methodology used is a mixed methods approach. We look at quantitative data from court research, court records, and then we interview survivors for qualitative data. We looked at a data set from 16 large counties, so across the country, and so we endeavored to find a diverse representation across demographics of all sorts, and then urban levels, sort of urban versus rural, to see where that data falls. We use, on a quantitative level, descriptive statistics, inferential statistics, and then qualitatively, we use thematic analysis of interviews. We coded that data and and use qualitative data analysis software in order to find the key themes across the data. And we go into more detail about that analysis in the article. Some of the key findings that you'll see, first regarding gender dynamics, that there's significant variations in IPV characteristics on gender, not just who victimizes who, but also the context of these victimization scenarios. When male defendants, male perpetrators of intimate partner violence are more likely to have a witness present. That's important because the data shows that even if a man has a witness there, that intimate partner violence may still occur. And then the chances of them being caught, convicted are likely higher because they have a witness there. Whereas with female defendants, it's less likely to be a witness. So men may not have their cases proven, or even a woman that's victimized by another female partner may not be able to prove her case. But also, fascinatingly, female defendants show higher weapon use. And that could be because of the strength dynamics and the strength deficit between men and women. Women who victimize may need a weapon because they can't overpower the man with just brute strength or brute force. Then there's the substance abuse correlation, which again, I thought was fascinating. A moderate positive correlation found between drug use and prior victim abuse, indicating that these issues are intertwined. So drug abuse is closely intertwined, at least moderately intertwined, as the data shows, with and moderately correlative with intimate partner violence. The impact of these findings, they highlight the need for interventions that consider gender-specific behaviors. How do women behave? How do men behave? That integrate approaches that address both IPV from a gender dynamic standpoint, but also from a substance abuse standpoint. And so if we get at the heart of some of these issues, like it's hard to get at the heart of like toxic masculinity and things like that in society. But one thing that is perhaps more easy to get to the heart of is substance abuse. And so if we can do that, that can help us solve some of these IPV incidences. So in conclusion, our study gives us a deeper understanding of intimate partner violence and emphasizes the interplay of gender, substance abuse, and historical abuse. We looked at, again, gender. We looked at substance abuse and also prior abuse and victimization. Those variables gave us a more comprehensive picture. Looking at them together fills in an important gap in the research. The implications of that is, of course, policy change. We can now tailor our prevention strategies that are more sensitive to the complexities that we found in the research. And we elaborate on some of those policy implications in the next slide, but also even more so in the article in the paper. Future directions we encourage further research to explore these additional factors, to explore additional independent variables. And then also once we go about implementing these specific interventions, to study their effectiveness. And so policy implications, gender-specific initiatives are important. We've sort of carried that theme throughout, developing programs that specifically address the distinct need of male versus female victims and perpetrators. And then sort of integrating those services that simultaneously tackle intimate partner violence, but also substance abuse issues. Again, looking for that root cause, doing that root cause analysis in these relationships and looking for what is really causing these issues, substance abuse being one of them. And then, of course, training and collaboration among law enforcement, among mental health experts, among teachers, educators, among different people in various fields, counselors, substance abuse counselors, emphasizing the importance of trauma-informed training for all professionals involved in intimate partner violence intervention, and then just the need for collaboration among the different sectors to sort of work towards solving that problem. Those are the policy initiatives that we thought were especially important. Just some key references for you. There are many more in the paper. So again, just to summarize, when we think about intimate partner violence, I hope that we look at it from a broader perspective than just poor male perpetrating violence against poor female. Although that is definitely a huge chunk of the discussion, now we can look at the nuances of intimate partner violence and see how this impacts a wider range of individuals across demographics. Thanks so much.